Here at ONS 2010, Oncology.TV, discussing integrating quality palliative care practice guidelines with Dr. Marie Bakitas from the Norris Cotton Cancer Center at Dartmouth Hitchcock Medical Center. Thanks for joining us.
Thanks for having me.
So how can palliative care best be provided to patients who have advanced forms of cancer?
Well, like an oncologist colleague of mine says, early, often, and everywhere. So palliative care is really best provided from the time of diagnosis with a new advanced cancer, and it provides holistic care attending to physical symptoms, psychological, social, spiritual consequences. The session that we presented today talked about the various settings in which palliative care can and should be provided. So beginning with in the hospital setting, as well as outpatient, nursing home, community, and finally hospice care.
How can staff nurses make a difference in getting palliative care developed in places where they work?
So the first thing is to not try to do anything alone. Integration of palliative care at the time of a new diagnosis of advanced cancer is not a concept that is accepted by all oncology providers. They see palliative care and oncology care as an either-or. And we like to think of it as a both-and. The reality is that the American Academy of Hospice and Palliative Medicine, ASCO, Oncology Nursing Society, World Health Organization guidelines all refer to the importance of integrating palliative care at the front end, but not everybody accepts that. And so at Dartmouth, at the Norris Cotton Cancer Center, we recently completed a study whereby we tested that theoretical model of introducing palliative care at the time of new diagnosis. And we found that this intervention improved quality of life, it improved depressive symptoms, and actually survival was longer in those patients. And so we were able to introduce palliative care at the time of diagnosis by way of a research study. And so we were able then to demonstrate the study was published in JAMA, a Journal of the American Medical Association, in this past August. And so we were able to demonstrate with an evidence base that that's the way to go if you want to provide state-of-the-art care. Now, as individual staff nurses, you may not have all of the resources by way of a research study, by way of colleagues who are experts and can accept these kinds of practices in their everyday practice. And so finding those among you who are still enthusiastic about doing this type of care, maybe forming a task force, having the evidence of guidelines behind you, those are all methods that individual nurses at the bedside can start to bring these concepts into their everyday practice.
The exercises, the methods you just mentioned, are they the way to bridge the gap between the differing viewpoints on palliative care, or is there something else that needs to be done?
I think it's really a culture change. I think integration of palliative care at the beginning of a diagnosis is a culture change. And as I said, in our institution, we're a National Cancer Institute Comprehensive Cancer Center that is excited about providing potentially new curative treatments, investigational therapies. We were able to get the oncology staff, oncology team of investigators really excited about palliative care because it was brought in by way of a research study. And so palliative care focuses on living better through their treatments, living better and having a better quality of life, not just for the person but their family. In these ways, patients were able to tolerate those phase 1 studies, those investigational trials, even better than if they were out, sort of on their own doing those investigational trials alone. So that was a real culture shift. And I think, again, whatever works in your organization, for us, research is the prime seller And if in a community organization, it's about in the community having patients and family members talk about what great care they got. Palliative care as a method is one of the ways that great care is going to be perceived by your patients and families, and it's going to be a marketing tool. So I think it's got to be, the message of integrating palliative care into oncology care has to be tailored to the setting and the culture that you're trying to integrate it into.
Thanks for coming by and sharing some of your time and your passion for what you do.
Thank you for inviting me.
Dr. Marie Bakitas here at ONS 2010 on Oncology.TV.